Most people think about muscle loss in their legs, their arms, their core. But there's one muscle almost everyone ignores until it's too late. Your tongue. Your tongue is pure muscle. It's one of the strongest muscles in your body relative to its size, and it has one critical job: moving food and liquids safely from your mouth to your stomach without letting anything enter your airway. After 60, tongue strength declines faster than most other muscles. Research published in Dysphagia found that up to 40% of adults over 65 have measurably weak tongues, and many don't know it until they start choking, coughing during meals, or developing recurrent pneumonia from aspirating food particles into their lungs. Aspiration pneumonia is one of the leading causes of death in older adults, and weak tongue strength is the primary risk factor. Today, I'm going to teach you a simple 10-second test you can do right now to assess your tongue strength and the exercises that prevent choking, aspiration, and the life-threatening complications of dysphagia. First, drop your name and where you're watching from below. By the end of this video, you'll understand exactly why tongue strength is critical for safe swallowing after 60, and you'll learn how to test your tongue strength at home, interpret the results, and perform the specific exercises that rebuild tongue muscle and prevent aspiration. This isn't just about comfort, it's about survival. Before we begin, this video discusses swallowing function and aspiration risk, not medical diagnosis. If you're currently experiencing frequent choking, coughing during meals, unexplained weight loss, or recurrent respiratory infections, consult your doctor or a speech-language pathologist immediately. These are signs of dysphagia requiring professional evaluation. Let me explain why tongue strength matters so much for swallowing safety and what happens when it weakens. The role of tongue strength in swallowing. Why weakness is dangerous. Swallowing happens in 4 phases. The oral preparatory phase, you chew food and mix it with saliva. The oral phase, your tongue pushes the food bolus backward toward your throat. This requires significant tongue strength and precise coordination. The pharyngeal phase, your throat muscles contract, your larynx elevates, and your epiglottis closes over your airway to prevent food from entering your lungs. The esophageal phase, food moves down your esophagus into your stomach. The oral phase, controlled by your tongue, is the trigger for everything else. If your tongue is too weak to propel food backward with enough force, the entire swallowing sequence becomes delayed, uncoordinated, or incomplete. When tongue strength is inadequate, several dangerous things happen. Food lingers in your mouth longer, increasing choking risk. The swallow reflex is delayed, giving food more time to slip toward your airway before protective reflexes activate. Food residue remains in your mouth and throat after swallowing, which you may aspirate later. Liquid, which moves faster than solid food, becomes especially dangerous because weak tongue control can't manage the speed. Research from the Journal of Speech, Language, and Hearing Research shows that reduced tongue strength is the strongest predictor of aspiration in older adults, even more than age, general weakness, or other health conditions. Aspiration, when food or liquid enters your airway and lungs instead of your esophagus, causes immediate choking and coughing. But silent aspiration, where material enters your lungs without triggering a cough reflex, is even more dangerous. This leads to aspiration pneumonia, a severe lung infection that's difficult to treat and often fatal in older adults. The tongue strength test. How to assess yourself at home. There are clinical devices called the Iowa Oral Performance Instrument that measure tongue strength precisely, but you can perform a functional assessment at home that reveals whether your tongue strength is adequate. Test 1. Tongue-to-palate press. Sit comfortably. Place the tip of your tongue on the roof of your mouth, just behind your front teeth. Now press your tongue upward against your palate as hard as you can. Hold for 5 seconds. What to assess? Can you generate strong, sustained pressure? Does your tongue feel like it's pressing firmly? Or does it feel weak and trembling? Can you hold the pressure for the full 5 seconds without your tongue slipping or weakening? If you can press firmly for 5 seconds without trembling or slipping, your anterior tongue strength is likely adequate. If you struggle to maintain pressure, feel significant fatigue, or can't hold for 5 seconds, your tongue strength is reduced. Test 2. Tongue-to-spoon resistance. Take a spoon. Place the back of the spoon against your lips, bowl facing outward. Stick your tongue out and press the tip of your tongue against the spoon as hard as you can. Try to push the spoon away from your face using only your tongue. What to assess? Can you generate enough force to move the spoon? Does your tongue feel strong and stable, or weak and shaky? If you can easily push the spoon outward with your tongue protrusion strength is adequate. If the spoon barely moves or your tongue fatigues quickly, your strength is insufficient. Test 3. Lateral tongue strength. Press your tongue against the inside of your right cheek as hard as you can. Hold for 5 seconds. Repeat on the left side. What to assess? Can you create a visible bulge in your cheek from the outside? Does the pressure feel strong and even on both sides? Can you hold without fatigue? If both sides feel equally strong and you can hold 5 seconds easily, lateral tongue strength is good. If one side is noticeably weaker or you can't sustain pressure, strength is compromised. Test 4. Functional swallow test. Take a small sip of water. Swallow normally. Assess. Did the swallow feel smooth and complete? Did you need to swallow multiple times to clear your mouth? Did you cough or feel like water went down wrong? Now take a larger sip, about 1 tablespoon. Swallow. Same assessment. If you can swallow both amounts smoothly without coughing, double swallowing, or sensation of residue, your functional swallowing is likely safe. If you cough, need multiple swallows, or feel water lingering in your throat, you may have dysphagia. If you fail any of these tests, especially the functional swallow test, consult a speech-language pathologist for formal evaluation. Why tongue strength declines after 60? Several factors contribute to tongue muscle weakening. Sarcopenia, age-related muscle loss, affects the tongue just like other muscles. After 60, muscle protein synthesis decreases, and without targeted use and resistance, tongue muscles atrophy. Neurological changes. The hypoglossal nerve, cranial nerve.si, controls tongue movement. Age-related nerve degeneration reduces the quality of signals sent to tongue muscles, impairing strength and coordination. Dehydration and dry mouth. Saliva lubricates the tongue and mouth. Chronic dehydration, common in older adults, makes tongue movement harder and reduces sensory feedback that guides swallowing. Medications. Many medications cause dry mouth, sedation, or muscle relaxation, all of which impair tongue function. Common culprits include anticholinergics, opioids, benzodiazepines, and certain blood pressure medications. Stroke or neurological disease, previous stroke, Parkinson's disease, ALS, or other neurological conditions directly damage the neural pathways controlling the tongue. Disuse. If you eat only soft foods, pureed diets, or liquid nutrition, your tongue isn't challenged. Like any muscle, without resistance and use, it weakens. The good news: tongue strength is trainable at any age. Research shows that even adults in their 80 seconds and 90 seconds can significantly improve tongue strength with consistent exercise. Tongue strengthening exercises. The protocol that prevents aspiration. These exercises are used by speech-language pathologists to treat dysphagia and have been proven effective in clinical trials. Exercise 1. Tongue pressed to palate. Place your tongue tip on the roof of your mouth, just behind your teeth. Press upward as hard as you can. Hold for 5 seconds. Relax for 3 seconds. Repeat 10 times. Do this 3 times per day. This strengthens the intrinsic and extrinsic tongue muscles responsible for propelling food backward during swallowing. Exercise 2. Tongue protrusion with resistance. Stick your tongue out as far as possible. Use a clean finger, tongue depressor, or spoon to press against your tongue tip. Push your tongue forward against the resistance. Hold for 5 seconds. Relax. Repeat 10 times, 3 times per day. This builds the genioglossus muscle, which controls tongue protrusion and is critical for moving food out of your mouth. Exercise 3. Lateral tongue presses. Press your tongue against the inside of your right cheek as hard as you can. Hold for 5 seconds. Relax. Repeat 5 times. Switch to left cheek. Repeat 5 times. Do this 3 times per day. This strengthens the lateral muscles that stabilize the tongue and control side-to-side movement during chewing and swallowing. Exercise 4. Tongue elevation. Open your mouth. Lift your tongue to touch the roof of your mouth as far back as you can reach. Hold for 5 seconds. Relax. Repeat 10 times, 3 times per day. This trains the muscles that elevate the back of the tongue, essential for triggering the pharyngeal swallow reflex. Exercise 5. Tongue curl. Curl your tongue backward, trying to touch the back of your tongue to the roof of your mouth. Hold for 5 seconds. Relax. Repeat 10 times, 3 times per day. This challenges the tongue's full range of motion and strengthens the muscles involved in complex swallowing patterns. Research from the American Journal of Speech-Language Pathology shows that adults who perform these exercises for 8 weeks improved tongue strength by 40% on average, and significantly reduced aspiration events during swallowing assessments. Additional strategies to protect swallowing safety. Beyond tongue exercises, several strategies reduce aspiration risk. Stay hydrated. Drink water throughout the day to maintain saliva production and lubricate your mouth and throat. Dehydration thickens saliva and makes swallowing harder. Sit upright when eating. Never eat lying down or reclining. Gravity assists swallowing when you're upright. Sit at a 90-degree angle with your head slightly forward, chin tucked, not tilted back. Take small bites and sip slowly. Large bites and gulps overwhelm your swallowing system. Small, manageable amounts give your tongue time to control the bolus safely. Chew thoroughly. The more you break down food before swallowing, the easier it is for your tongue to manage. Aim for 20 to 30 chews per bite for solid foods. Avoid talking while eating. Talking and swallowing use overlapping muscles and neural pathways. Doing both simultaneously increases aspiration risk. Modify food textures if needed. If you're having difficulty with thin liquids, consult a speech therapist about thickened liquids. If solid foods are problematic, softer textures may be safer while you rebuild tongue strength. Clear your throat after swallowing. If you feel food residue in your throat, clear it with a gentle cough or second swallow before eating more. Residue left behind can be aspirated later. When to seek professional help. See a speech-language pathologist if you experience frequent coughing or choking during meals, sensation of food stuck in your throat after swallowing, need to swallow multiple times to clear your mouth, unexplained weight loss or decreased appetite, recurrent respiratory infections or pneumonia, or wet, gurgly voice after eating or drinking. These are signs of dysphagia requiring professional swallow evaluation, often including a modified barium swallow study that uses X-ray imaging to visualize exactly what's happening when you swallow. Early intervention dramatically improves outcomes. Dysphagia is progressive if untreated, but highly responsive to therapy when caught early. Your tongue is not just for talking or tasting. It's a survival muscle. It's the gatekeeper between nutrition and aspiration, between safe eating and life-threatening pneumonia. And like every muscle, it needs attention, exercise, and respect. If you're going to start tongue strengthening exercises today, leave a comment and commit to it. And if this video taught you something that could prevent choking or aspiration in yourself or someone you love, share it. Because most people don't think about their tongue until it fails them. And by then, it's often too late. Because the strongest thing about you isn't your tongue. It's your willingness to train what you can't see to protect what matters most.